Hello and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. In an effort to curb rising medical costs, the government has announced that starting May 1st, all private healthcare facilities are required to publicly display the prices of all medicines they sell, supply or administer. However, this policy has sparked some debate. So tonight on the show, we'll consider how this policy might affect both private healthcare providers and also patients. Joining me on the show is Azrul Mohd Khalib, who is the CEO of the Galen Centre for Health and Social Policy. Azrul, welcome to the show. The Galen Centre put out a statement recently saying that the drug price display policy could actually backfire and worsen medical inflation. I was curious about that. Could you elaborate? How do you see this policy doing more harm than good?
Thank you, Melissa. You know, when you look at it from a theoretical standpoint, mandating price display for drugs and medicine in private hospitals, clinics, dentists and pharmacies could actually inform and empower consumers to, compare out-of-pocket costs and choose lower cost options, and perhaps even introduce competition between healthcare providers. And this enables there to be some sort of management for the prices of pharmaceutical products through free market forces. And that's what we have in Malaysia, free market. And price display isn't new. If you go to a pharmacy today, you see them. They've been doing it for decades. And so displaying prices is a reasonable action, which makes medicine pricing more transparent. I mentioned just now, possibly competitive, as they're currently usually bundled into clinic hospital fees. And you can actually decide whether to fill your prescription at the clinic or hospital or go to a pharmacist. Currently, there's a mistaken assumption that you have to go to the clinic or be forced to get your medicine at the clinic that you visited. Now, that's not true. You can actually take the prescription they get from your doctor and fill it in at the nearby pharmacy and so forth. So the issues here are basically that the drugs or the medicines that are being prescribed to you, you should be able to shop around basically and find out what's the best deal you can get. But the problem here is this, Melissa. Unlike everyday products, like eggs, chicken, fish, and other staples, the names, types, and formulations of drugs are largely unfamiliar to patients who largely depend on medical health professionals to advise, determine, and prescribe what is needed for the treatment. Now, patients are even advised to refrain from depending on their own research or depend on Dr. Google, and how will consumer choice work when this is an area needing specialized knowledge to decide on what drug, dosage, frequency, application, there's oral, intravenous, subcutaneous, should be administered to a patient. It could even bring about patient harm or adverse events due to inaccurate intake of the drug. So there's a problem here when we talk about economic theory and the invisible hand, so to speak, because it's very hard for there to be a reference here or standard to measure against when the person themselves don't know. So my worry here is this, is that private hospitals, clinics, and pharmacies, God forbid, could basically collectively and collaboratively even mark up the price of drugs currently, even higher after adopting price displays, because patients just are not likely to know what the recommended retail price for the specific medicines are before entering treatment. And it's instead of curbing medical inflation, this actually could be inflationary. And that's not even including wastage that is possible, because you think that you go to a pharmacy, you can get a cheaper deal. But actually, what happens is the prescription that's given by the doctor is very specific to what is being treated. So it's a duration, how many pills you have to take a day, for what duration. But in the pharmacy, you could be forced to buy a box instead of the exact prescription that's given by a doctor, because pharmacies don't sell, like just a slab perhaps, or just a few pills. They maybe sell boxes or,
Right.
So it could actually cost more by visiting a pharmacy.
Okay, so from what I understand from some of the medical groups is that the concern is not so much about the price transparency, but rather what legislation it falls under. So what is its punca kuasa essentially? And there's been concern that it doesn't fall under the Private Healthcare Facilities Act, that it falls under the Price Control and Anti-Profiteering Act. Help me understand why that is a concern.
Well, actually, I think in this particular case, the medical professionals are very concerned that there are overlapping legislation that is governing healthcare. And the reality here is that Malaysia doesn't have a specific legislation to look at price marking of pharmaceutical products. So if you look at the legislation, I think it was mentioned, the Private Healthcare Facilities and Services Act, the Poisons Act, and the Sale of Drugs Act. These are all very much linked to the monitoring, the regulation of quality, efficacy of the services and the drugs that are being sold. But it doesn't deal with the price marking. And that's where price marking is only provided for under the legislation that everybody's quite concerned about, which is the one that deals with price control and Anti-Profiteering Act with the 733. So unfortunately, in this particular case, we actually have to refer to that particular legislation to regulate price controls. But you know, the issue here, price marking, sorry, Melissa. So the problem here is really this: the private clinics really, when you look at it, what their main issue here. So the problem here is that it could affect their business, and private clinics depend on two main sources of revenue: consultation fees and charging for treatment, which is where the drugs are. Now the fees have been the same and frozen for 33 years. It's stuck at 35 ringgit. How else are clinics to make money other than charging for medicine and treatment and care with a profit margin? You know, you got to pay salaries, overheads, and don't forget also, there's also in Malaysia the use of third-party administrators or TPAs by employers, which are organizations that handle all the medical claims and related services for bigger companies, employers, and other groups, and they charge a commission on their services. So health, and in this case GPs, are businesses after all, and you know, these are concerns for which the policy is not being implemented in vacuum. And I have to stress this, that consultation fees have been in stasis or limbo for 33 years.
Okay.
You pay more to a locksmith or for a plumber and even a bottle of shampoo when compared to GP fees at 35 ringgit.
So you're saying address also consultation fees while looking at this. But talk to me about so you talked about how GPs are also a business, right? Isn't this policy meant to confront profiteering in private healthcare? Because we have heard of claims of medicine markups as high as, you know, several 100%, some claim. But wouldn't this help then address those issues?
Well, you know, again, when we look at it in context, the percentage may sound huge, but the amount may not be so. So we have a situation where, because there is this fixed fee for which you cannot go beyond, and for GP fees it's between 10 ringgit to 35, and specialists it's between 80 to 235, stuck since 1992, you cannot go more than that. So if you are going to go more than that, and bearing in mind inflation goes up, you know, cost of living and so forth, the only thing that you can adjust is really the price of medicines, the treatment fee, the treatment itself. So if you get something for 2 ringgit, for example, and say a slab of Panadol costs 2 ringgit, if the GP sells it for 4 ringgit, that's 100% increase, right? But it's just 4 ringgit. So when you look at the different drugs, there are markups. It's either in like 10%, 15%, or even 300%, depending, but not exorbitantly so. And this is because the reality of it is that the inflation rate that also affects GPs being transferred to patients themselves. So it does cost a little bit more, but the fact of the matter is that a lot of people go to GPs because of the services that they're able to provide, the convenience, the ability to access immediate care as opposed to waiting for hours at a KK or government clinic, or having to wait, you know, to go for an X-ray or to get some minor surgery done, which you have to wait maybe longer at a government facility. So it's important that we compensate them for these services.
Right. So talk to me about whether you think this policy is fundamentally flawed, or should there be other measures that accompany it that will help reform the sector and achieve the results that the government wants to achieve while protecting all the ecosystem that's already in place?
Well, Melissa, I don't think the policy itself is flawed. I think anybody would be reasonable to expect that whatever you buy, whatever you procure, should have a price tag on it. And we want to be able to compare, but medicine isn't easy or such a thing that we can do window shopping. It's not that straightforward. We actually have to have a guided discussion with your healthcare practitioner to be able to ensure that we are getting the right drugs for the right purpose and taking into consideration things like allergies, adverse events, and so forth, which could do us more harm. So the problem here is this, and we look at the pragmatic application of this piece of policy that is going to be put into place, is that a private clinic could have 100 drugs in its dispensary. In a pharmacy, you could have thousands, which would need to be listed under this law. So this policy, should the price display be in the form of a transparent folder, like all those Malaysian graduates displaying their academic certificates? Should it be on like A1 sheets of paper, and then you put it on the clinic waiting room? So instead of all those posters telling us to reduce cholesterol, take care of your health, cut down on your sugar, now you have lists of all the drugs and equipment that there. So how often will these lists need to be updated? How much detail is going to have to be in there to ensure compliance? Because what we want to also make sure that this isn't a gotcha moment for enforcers to trap healthcare facilities to non-compliance. And the fact is that there are many challenges here to regulatory compliance, because one of the things that could be quite worrying for patients is that this could actually force private clinics to just eliminate or do away with their dispensary altogether, because the regulatory burden is too much. They decide, oh, forget it, I'm just going to not have a dispensary. I'm not going to dispense medication at all. I'm just going to provide consultation, which basically means there is a practice of dispensing separation, where doctors provide diagnosis and treatment, and then medicine is collected from a pharmacy via prescription, because it could be just too much of a burden maintaining an on-site dispensary, and they might decide that it's just not worth it despite the loss of income. And you can see in other countries that there is dispensing separation.
Is that the goal for Malaysia, Azrul? Do we want to encourage dispensing separation?
Well, I can tell you Malaysian patients are going to be grumbling. They're going to protest against it because people like it. We are very fortunate here in Malaysia where we can go to a clinic, within a short period of time, just walk out the door, go to a clinic, you see the doctor, get a prescription, and get your drugs right there and then. You can spend like maybe an hour or two, and you can get that process all done. In other countries where there's dispensing separation, to just see the GP could take 2 weeks. In the UK, you get an appointment to see the GP, after which you get a prescription, and then you get the prescription, you have to go to a chemist or a pharmacist to get the drugs, and it takes a whole long time, and it could take more time than you could actually afford. Whereas here in Malaysia, you get your medication at the same place that they're diagnosed and treated. And here's the thing, a lot of people don't know that if they feel that after the first visit that they can't afford the treatment, particularly if they're paying out of pocket, it's not panel doctor cover, you can actually just go to a public clinic or hospital instead, or take that prescription that the government, take that prescription that the doctor has provided to you and fill it at a pharmacist. So the problem here is that one additional worry for me, Melissa, is that the drug price display could also hamper or restrict the ability of healthcare providers to provide collective package bundling, where you have a single payment and it covers multiple healthcare services and supplies for a specific episode of care. And it might introduce a rigidity into the costing of pharmaceutical products, where right now, you have discounts or bundling, which you benefit from. And it's very important to mention that, because a lot of the community clinics, the GPs, they know a patient and say, oh, it's okay, I give you discount. And then it becomes cheaper, right? So I'm worried that it will affect the ability for patients to access the care that they need.
Azrul, thank you so much for joining us on the show. Azrul Mohd Khalib from the Galen Centre for Health and Social Policy. We're going to take a quick break here and consider this. We'll be right back. Stay tuned. Hi, welcome back to Consider This. I'm Melisa Idris. Let's continue our conversation about the government's mandate that as of 1st May, that healthcare professionals or healthcare providers, private healthcare providers, are required to publicly display the prices of the medicines they sell, supply or administer. Joining us now to discuss this further is health policy researcher Dr Lim Chee Han, who is the senior researcher for the non-profit advocacy group Third World Network. Dr. Lim, thank you so much for being on the show with me today. As an overview, how do you see this mandate requiring medicine price displays? Is it a positive thing or a negative thing for consumers?
Thanks, Melissa, for having me here. Yeah, that's definitely a positive move for consumers and patients alike. Why is that? Because for so long in Malaysia, medicines have been strangely exempted from having to display prices in the private healthcare sector settings. The consequences actually are quite disastrous because medicine prices in the private healthcare settings are generally higher, with very high markups on the items and a very wide variation of price range of the same product. I just want to give you some numbers. According to the Medicine Prices Monitoring in Malaysia Survey 2022, the average markup on generic medicines in private clinics is 140%. And in the private hospital admission ward, which is actually 280%. That's just an average, let me remind you. And the average price variation for a particular medicine can be 200%, sorry, in private clinics, which means you will be very often find one clinic sells a medicine at 10 ringgit, while another clinics may sell it at 20 ringgit just next door. So you have to ask yourself why there is such a wide price variation and why the markup can be so high. So I would like to point out that the consumers and patients actually have no way of knowing the selling price of medicine in these facilities. So without such information, they actually cannot compare and choose. So they cannot make an informed decision based on price. Often they only know, yeah.
Right. So, sorry, if I may just interject here. So you're saying the transparency will benefit consumers and they can kind of shop around for more competitive price or one that suits their budget. There are those who say that this might disproportionately affect small clinics and GPs, which at the end of the day are businesses. Their consultation fees have not been revised for over 30 years. What's your response to those who worry that while it's well-intentioned, it could make it harder for the very vital primary care providers to survive, and some of the markups, while they may sound big in percentage, actually are small in amount, maybe even a few cents or ringgit. How would you respond to that, Chee Han?
Yeah, I do support their call for revision of the doctor's consultation fee because it has not been revised for more than 30 years. It's rightly to do so. But I think they should not confuse the revision of the consultation fee with other item policy like drug price display. Because one thing is we talk about the transparency. I think it's consumer rights to know about prices. Another is their revenue. They have to go back to their the root of their problems to solve it from there. And the minister already promised that he will deal with it and promise to revise within this month. So we should wait and see.
Okay, all right. So what other measures do you think should accompany the price display mandate? So you talked about revising the consultation fees. Anything else that you think would make it more effective if the primary objective of government is to tackle medical inflation, reduce medical cost?
Yeah, actually, before this drug price display policy, actually is the government has this policy called medicine price mechanism. The original policy is actually dated back in 2019, where the cabinet under the Pakatan Harapan 1.0 under Health Minister Zulkifli actually have the mandate to regulate the markups on the single source medicine, which are mostly the patented original medicine at the retail level, and the drug manufacturer and importers have to declare and set the maximum wholesale prices at the same time. But you know that this, because of a very strong objection from the industry, the ministry actually backing down and watering down right now just to ask the retailers and the healthcare facilities to declare prices. This actually is not a price control, because they can still set the margin higher. And we all understand right now, because of their doctors' consultation fee and what's so on, we understand they can set the margin higher. But I think as times go on, if the problems of their, for example, their consultation fee has been revised, so I think we have to go back to the policy where the fairness, the market competition should be emphasized. Yeah, so the right for the consumers to know the prices so they can make the best plan for the affordable healthcare savings. I mean, this is very important to them also.
I understand. Chee Han, consumers, like myself, we have limited knowledge about pharmaceuticals. We don't really understand, you know, any dosage and type. I can't even name the brand names of some of the medicines. So how would consumers with not enough information, without that specific knowledge, be able to use this price display to our advantage if we don't know what we're looking for? How would you advise consumers with limited medical knowledge to understand? What do we need to understand about the price of medicine and about how it's determined?
Yeah, I think it's a very good time for the consumer and patients to learn about medicines, because we need to know there are two kinds. One is called originator, one is called generic medicines. So usually when the medicines are new to the market, there are only one medicine available, which is the originator, and usually is the highest, command the highest premium in terms of a price margin. So when there is the patents for the medicine expires, the generic medicine comes in, and usually the prices of the originator will drop by at least half compared to the generic. So don't be worried, because generic medicine in Malaysia meet very high standard and of the regulation, so they have the same efficacy, same safety and quality features as the originator. So if you have a chance, if you have a choice to buy generics, you can actually save a lot of money.
Okay, all right. So it could be to the benefit of consumers if you make kind of informed decisions. May I ask you if this has worked in other countries, whether the displaying of drug prices in healthcare providers, whether there has been evidence that it has led to better medical inflation control?
Actually, drug price transparency policy and mechanism is actually recommended by WHO back in 2019, and Malaysia is also co-sponsor to one motion at the World Health Assembly on this motion. I think it's an international good practice, because without the transparency, there is no healthy and fair market competition where the practitioners can just set any price they want, and the consumers and patients do not know what are the selling prices until when they receive their bills, and often they receive the bill without the detailed itemized bill. So actually they do not know how to, in that case, you won't see the price go down, because they can just do so, setting at the high prices. So price transparency is not a guarantee to keep everything, the prices low, but it's a very necessary first step, because without transparency, nothing will work.
I understand. Are you concerned that there could be any, I was going to say adverse reactions, but that's too much of a pun, any unintended consequences from this policy if it's not implemented well, if it's not rolled out with, given enough consultation with the stakeholders and allowing stakeholders to adapt or adopt it well?
I want to clarify about the not enough consultation. Actually, the government has been engaging with the industry for over 6 years, since 2019, on the various price mechanism. So you cannot say the industry doesn't know that what is coming. But I think in this policy, government has given a leniency period and for education, for them to make the practice right. I think once everyone's doing that, it's just a norm. Then I think there's just the initial stage. You have to set up something, a template. Other than that, after that, you just adjust the prices. I think it's easy work. And when they have do the good inventory stocking, I think this just come naturally in the digital world.
Okay, well, thank you so much, Chee Han, for giving us some of your perspective, your analysis about this policy. That was Dr. Lim Chee Han from the Third World Network, wrapping up this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.